The night the train stopped in Wyoming. He said, "I've been shot at twice and jumped out of a moving Humvee once. I think I can handle a little needle." And then he looked away, which, honestly, told me everything I needed to know. I want to tell you about a Tuesday in November, the kind of Tuesday that doesn't announce itself as anything special. You wake up, you pack your bag, you board a train in Chicago because you decided, somewhat impulsively, somewhat deliberately, that you needed to see the mountains before winter closed them off. And somewhere between Cheyenne and Salt Lake City, at roughly 2 a.m, the train stops. Not slows, stops. The lights flicker once, twice, then settle into that low amber glow that Amtrak uses when it wants to pretend everything is fine. The heating system makes a sound like a sigh, and from 3 rows behind me, someone says, quietly but clearly, "That's not good." I remember thinking, no, it really isn't. But I also remember thinking something else, something I didn't fully understand until much later that night. I remember thinking that I was exactly where I was supposed to be. I didn't know yet why, but I would. Let me back up a little. I'd been traveling for about 6 hours by then. I had a window seat, a thermos of green tea that had gone lukewarm somewhere around Iowa, and a book I kept pretending to read while actually watching the darkness outside. There's something about train travel at night that does something to your sense of time. The windows become mirrors. You see your own reflection layered over the moving landscape, and you're not quite sure which one is real. My bag was in the overhead rack. In the bag, among the usual things, change of clothes, charger, that one granola bar you keep saving for a real emergency, was a small zippered pouch, dark green. The kind that looks like a toiletry bag but isn't. I always travel with it. Old habit. You finish nursing school, you do a few years in an ER, and your relationship with preparedness becomes personal. My mother used to say I packed for disasters. I prefer to think I pack for possibilities. The pouch had, among other things, a pair of nitrile gloves, a few alcohol prep pads, 2 small bandages, a 3-milliliter syringe still in its sterile packaging, and a single-dose vial of diclofenac, an anti-inflammatory, the injectable kind, that belonged to a patient I'd been managing for a colleague. I was supposed to deliver it to a clinic in Salt Lake City, routine transport, nothing dramatic. The universe, as it turns out, has a very specific sense of humor about the word routine. His name was Marcus. I didn't know that yet when I first noticed him, about an hour before the train stopped. He was sitting diagonally across from me in the aisle seat 2 rows up. Tall, you could tell even sitting down. Somewhere in his early 40s, maybe. Dark jacket. The kind with too many pockets that usually means either military or outdoor enthusiast. Short hair, the kind that grows out evenly and suggests it's been kept that way for a long time. He'd been fine for most of the trip, reading something on his phone, occasionally looking out the window, doing the same quiet nothing that everyone does on a long train ride. But around midnight, I started noticing things. The way he shifted in his seat more often. The way he pressed his palm flat against his right thigh, just above the knee, with the particular kind of pressure that isn't stretching, it's guarding. The way his jaw was set a little too carefully. I know that look. I've seen it on people who are trying very hard not to show that something hurts. I didn't say anything. It wasn't my place. He hadn't asked for anything. People are allowed to be in pain quietly on trains at midnight, and they're allowed to not want a stranger noticing. But I kept noticing. When the train stopped, the car filled with that particular energy of collective uncertainty. People woke up, looked around, reached for their phones. The conductor came through about 10 minutes later with the kind of calm, practiced voice that means the situation is being managed but not yet resolved. Mechanical issue. They were working on it. Probably an hour. Probably. I got up to stretch, walked to the small vestibule area between cars, where the air is always colder and there's always that faint smell of metal and motion, even when you're standing still. I stood there for a minute, rolling my neck, thinking about nothing in particular. That's when he came through. He was moving carefully, not limping exactly, but with that deliberate, controlled gait that people use when they're managing pain with every step and don't want it to show. He stopped when he saw me. There wasn't really room for two people to pass comfortably, and he did this thing where he almost smiled but mostly just looked tired. "Sorry," he said. "Needed to move." "Don't apologize," I said. "Me too." We stood there for a second, in that way that strangers do when they've accidentally occupied the same small space, and neither one is quite ready to retreat. And then, because I am who I am and I apparently cannot help myself, I said, "How long has your leg been bothering you?" He looked at me, not offended, more like caught. "That obvious?" "Only if you know what to look for." Another pause. The train hummed around us, doing nothing, going nowhere. "Couple of days," he said. "Old injury, sometimes it flares up." I nodded. "The cold doesn't help." "No," he agreed. "It really doesn't." His name was Marcus. He told me that a few minutes later, after we'd moved to the small, fold-down seats near the vestibule door, the kind that exist on trains for exactly this kind of accidental conversation. He'd been in the Army for 14 years, 2 deployments. The injury in his right thigh was from a training accident, not combat. He said that with a slight emphasis, like he'd had to clarify it before, and found the clarification slightly annoying. A fall, torn muscle, improperly healed, periodically inflamed. He had a prescription for an injectable anti-inflammatory that he used when it got bad enough. He'd run out 2 days ago in Chicago. He was managing. Manage was doing a lot of work in that sentence. I looked at him for a moment. I thought about the green pouch in my bag. I thought about the vial of diclofenac, which is, and I want to be precise here, a non-steroidal anti-inflammatory drug, commonly used for exactly this: acute musculoskeletal pain, inflammation. The kind of flare that comes from an old injury meeting cold weather and a hard train seat. I thought about the fact that we were stopped in the middle of Wyoming at 2 a.m, with at least an hour to go before anything moved. "What's your prescription?" I asked. He told me the name, the dose. I did the math in my head. "I might be able to help," I said. "I'm a nurse. I'm transporting medication for a patient. Different patient, but the same drug, same concentration. I'd need to check the dose, and I'd need you to understand that this is me using professional judgment in an unusual situation, not a formal clinical setting." He looked at me with an expression I can only describe as carefully calibrated skepticism. "You just happen to have injectable anti-inflammatories on a train." "I just happen to have injectable anti-inflammatories on a train," I confirmed. A beat. "That's either the most convenient thing that's ever happened to me," he said, "or the beginning of a very strange story." "Probably both," I said, "but the medication is real, and so is my license." We went back to the car. I retrieved my bag. He watched me unzip the green pouch with an expression that was trying very hard to be neutral, and not quite succeeding. I could see him doing what people do when they're deciding whether to trust someone, running through the evidence, the plausibility, the risk calculus. I laid things out on the tray table between us, methodically, the way I always do because order is part of the ritual, and the ritual matters. Gloves first. I always put gloves on before I touch anything else. It's not just sterility, it's a signal to yourself and to the patient that you've shifted into a different mode, that this is intentional, that you are present. The prep pads, the vial, the syringe. "You've done this before," he said, not a question. "Many times," I said. "This particular injection goes into the muscle, upper outer thigh in your case, given where the injury is. The vastus lateralis, that's the large muscle on the outer side of your thigh. It's one of the preferred sites for intramuscular injection because it's accessible, it's well vascularized, and there are no major nerves or blood vessels right where we're aiming." He was quiet, listening. "The needle goes in at a 90-degree angle," I continued, keeping my voice even and unhurried. "Straight in, not at a slant. People think angled is gentler, but it isn't. It increases drag, and it means the medication ends up in the wrong tissue layer." "Okay," he said. And then, almost despite himself, "I've been shot at twice and jumped out of a moving Humvee once. I think I can handle a little needle." And then he looked away. I smiled at that. Just a small one, mostly to myself. Here's what I want you to understand about intramuscular injections, because I think most people have a completely wrong picture of what's actually happening. The fear is almost always about the needle, the sharp thing, the puncture, the idea of metal entering the body. And I understand that fear. It's ancient, it's wired in. But the needle is actually the least complicated part. What matters is everything that happens before the needle moves. First, the site. For the vastus lateralis, the outer thigh, you divide the thigh into thirds. You want the middle third, outer aspect, not too far toward the front, not too far toward the back. If you press gently, you can feel the muscle beneath the skin. It should feel firm but yielding. That's where you're going. Second, the skin. You clean it with an alcohol prep pad and then, this is important, you let it dry, fully dry. Wet alcohol on the skin stings when the needle goes in, and it can introduce a small amount of alcohol into the tissue. 15 seconds. Just wait 15 seconds. It seems like nothing, but it matters. Third, the muscle. You want it relaxed. This is where most people make the mistake. They tense up, the patient tenses up, and suddenly you're trying to push through a contracted muscle, which hurts and makes the injection less effective. I usually ask the patient to let their leg go heavy. Not relaxed, heavy. There's a difference. Heavy is something the body understands. Relaxed is an instruction. Heavy is a feeling. I asked Marcus to let his leg go heavy. He tried. His jaw was still set. I could see the effort of it. "Tell me something," I said. Not to distract him, I genuinely wanted to know. "Where were you stationed?" And something in him shifted, just slightly. The jaw unclenched by about 10%. "First deployment, Germany. Second, Kandahar." "What was Germany like?" "Cold," he said, and almost smiled. "Really cold." "Worse than Wyoming in November?" "Different cold. German cold has more..." He paused, searching. "Intention." I laughed at that, genuinely, and in that moment, while he was half smiling at his own description of intentional German cold, I uncapped the needle, stretched the skin taut with my non-dominant hand. You always stretch the skin. It creates a firm surface, reduces drag, and makes the angle more precise. And inserted the needle at 90 degrees with a single, smooth, confident motion. He didn't flinch. I aspirated slightly, drew back the plunger just a fraction to check for blood return. This is something that's been debated in current nursing practice. Some guidelines have moved away from aspiration for certain intramuscular sites. But for the thigh, with an old injury, and potentially altered vasculature, I still do it. Old habit, good habit. No blood, clean placement. I injected slowly, not fast. The speed of introduction matters. Too fast, and the pressure in the tissue causes pain, sometimes significant pain. You want to feel like you're filling a space, not forcing entry. The full dose took about 10 seconds. Needle out. Gentle pressure with a clean pad. Not rubbing, pressure. Rubbing disperses the medication too fast and can cause local irritation. Done, I said. He turned back to look at me. He'd been staring at the seat in front of him the whole time. That's it? That's it. A pause. He looked down at his thigh as if expecting some visible evidence of what had just happened. Huh, he said. We sat there for a while after that. The train was still stopped. Outside, Wyoming was doing what Wyoming does at 2 a.m. in November, being vast and dark and indifferent in the most beautiful possible way. I could see a few stars through the window. Not many, just enough. I told him that the medication would take about 20 to 30 minutes to start working properly. That he should drink some water. Dehydration makes inflammation worse, and train travel is dehydrating in ways people don't always register. The recycled air, the low humidity, the tendency to drink less because the bathroom situation is inconvenient. I've seen people arrive at their destinations with headaches they attribute to stress, when really they're just mildly dehydrated. The signs are subtle: slight headache, dry mouth, feeling vaguely irritable for no reason you can identify. A liter of water over the next hour would do more for how he felt in the morning than almost anything else. He had a water bottle. He drank from it without argument, which I appreciated. "Can I ask you something?" he said after a while. "Sure." "Do you always travel with a medical kit?" "Always." "And you just help people? On trains? In the middle of the night?" I thought about how to answer that. There's a version of the answer that sounds heroic, and a version that sounds compulsive. And they're both a little bit true. I help people when I can, and when it's appropriate, I said. Tonight, it was both. He nodded slowly, looking at the window, at the stars, or at his own reflection. I couldn't tell. "My mother was a nurse," he said. 23 years in a VA hospital. I didn't say anything. Sometimes silence is the right response to a sentence like that. "She had the same thing," he said. "That thing you have, where you just notice when someone's not right." "It's not magic," I said. "It's pattern recognition. You learn what healthy looks like, and then anything that deviates from it catches your eye." She used to say something similar. He paused. She said caring was a skill, not a feeling. I sat with that for a moment. She was right, I said. Though I think it starts as a feeling, and then you build the skill around it. He looked at me then. Not the careful, calibrated look from before. Something quieter. "Yeah," he said. "Maybe." Around 3 a.m, the train started moving again. There was a small collective sound from the car, relief mostly, with a little irritation mixed in. People resettling. The heating system resuming its work with a series of clicks and sighs. Marcus's leg, he told me, was already better. Not gone. The inflammation would take days to fully resolve, and I told him so. But the acute edge of it, the sharp insistence that had been making every shift of position a small negotiation, that was easing. "You should follow up with your doctor when you get to Salt Lake," I said. "Not because of tonight was fine, but because if this is flaring regularly, There might be a longer-term management plan worth discussing. Physical therapy specifically. The vastus lateralis responds really well to targeted strengthening when the underlying issue is scar tissue from an old tear. It doesn't fix the scar, but it builds the surrounding muscle to compensate.
He nodded. I know, I keep meaning to.
Everyone keeps meaning to, I said. He laughed at that. A real laugh, not a polite one. It changed his whole face. I want to pause here for a second because there's something I've been thinking about as I tell you this story. Something about what it means to help a stranger. There's always a moment, and I've felt it dozens of times, in ERs and in living rooms, and apparently on stopped trains in Wyoming, where you cross from observer to participant, where you stop watching someone manage their pain and you step in. And that moment is never as simple as it looks from the outside, because you're making a judgment about competence, about consent, about risk, and you're making it fast, with incomplete information, in conditions that are not ideal. And you might be wrong. I've been wrong before, not catastrophically, but I've misjudged situations, offered help that wasn't wanted, made assumptions about what someone needed that turned out to be off. Every one of those moments taught me something, usually something uncomfortable. I think about that. I think about whether I'd make the same call again, each time. And the honest answer is, mostly yes, but not always in the same way. I wonder, sometimes, where you'd draw that line. If you were in that train car. If you had the knowledge, and the medication, and the stopped train, and the man with the guarded jaw, what would you do? I think about that question more than you'd expect. We talked until almost 4, not about anything dramatic, just the easy, slightly surreal conversation that happens between strangers when normal time has been suspended. He told me about Salt Lake City, where his sister lived, where he was going for her wedding. He told me about the Army, not the hard parts, the funny parts, the bureaucratic absurdity of military logistics, the inexplicable rules, the way 12 people can share a confined space for months and develop a shorthand that takes years to lose. I told him about nursing school, about the professor who used to say that the most important tool in medicine was the ability to be comfortable with uncertainty, about my first solo 1-5 placement, which went beautifully, and my second, which absolutely did not, and the particular humility of learning something that involves other people's bodies. What does it feel like, he asked, when you find the vein? I thought about how to describe it. It's one of those things that's hard to put into words because it's primarily tactile. It lives in the fingertips, not in language. There's a resistance, I said, and then a give, like pressing through a thin membrane. When you get the flash of blood in the chamber, you know you're in. But honestly, before that, you can feel it, the difference between tissue and vein. The vein has a slight spring to it. It moves under the needle, and then it accepts it. He was quiet for a moment. That's a strange thing to find beautiful, he said. Most of the things I find beautiful are strange, I said. I should tell you about the moment I almost didn't help him, because I think that's the more honest part of the story. When I first noticed him on the train, the guarded posture, the careful gait, my first instinct wasn't to help. My first instinct was to mind my own business, which is a valid instinct. People have the right to their own pain, their own management strategies, their own decisions about when and how to ask for help. And there was something else, a tiredness, not physical, professional, the kind that accumulates over years of being the person who notices, who steps in, who carries the weight of other people's bodies and fears. There are days when you want to just be a person on a train, when you want the knowledge to stay quiet inside you instead of pulling you toward whoever needs it. I almost let that tiredness win. I'm glad I didn't. But I want you to know it was there. Because I think we sometimes tell stories about helping in a way that makes it sound effortless and obvious. And it isn't always. Sometimes it costs something small. Sometimes you have to choose it. The train pulled into Salt Lake City at 6:47 in the morning. Earlier than expected somehow. They'd made up time in the last stretch. The light was extraordinary. That particular winter morning light that comes when the sun is still low and the air is cold and everything has a slight blue edge to it. The mountains were visible from the station, white-tipped, enormous, doing their usual thing of making everything human feel appropriately small. Marcus stood up carefully, testing his leg. I watched him, professionally, the way I couldn't help watching. Better? I asked. Significantly, he said. He picked up his bag, looked at me for a moment with that quiet expression from the middle of the night. Thank you, he said. Really. Follow up with your doctor, I said, and drink water. He smiled. Yes, ma'am. I watched him walk down the aisle toward the door. He was still careful, still deliberate. The inflammation wouldn't be gone for days. I'd told him that. But the guarding was less. The jaw was unclenched. He moved like someone who had been given a little relief and was trying not to take it for granted. I found a coffee shop near the station and sat there for an hour before my connection. Green tea, not coffee. I know, I'm a cliché. The mountains were visible through the window. The city was waking up around me in that slow, considered way that cities do on cold mornings. I thought about what Marcus had said, about his mother, about caring being a skill, not a feeling. I've been turning that over ever since. Because I think there's a third thing, something between skill and feeling, a kind of attention. The willingness to keep your eyes open even when it's easier to look away. To let the information in, even when you're tired. Even when you'd rather be just a person on a train. That's not a skill you learn in school. And it's not exactly a feeling either. It's more like a choice you make, over and over, until it becomes habit. Until it becomes who you are. I don't know if that's a good thing or a complicated thing. Probably both. The vial of diclofenac I'd been transporting, the one for the clinic, I delivered it that afternoon. The clinic pharmacist signed for it, filed it away, moved on to the next thing. Routine, as it was always supposed to be. I thought about telling her about the night, about Wyoming at 2 a.m. and a man with a guarded jaw and stars through a train window. About how the medication had taken a small detour on its way to her. I didn't. Some stories belong to the people who were in them. But I thought about it. He said, at the beginning, before any of it, that he'd been shot at twice and jumped out of a moving Humvee once, that he could handle a little needle. And then he looked away. I think about that now and I think, yes, he could handle the needle just fine. That was never really the question. The question was whether he'd let someone help him, whether he'd accept the care, the attention, the small intimacy of a stranger's hands and a stopped train and 2 a.m. He did. And I think that was the harder thing. Not the needle, not the pain. The letting someone in. I think that's the harder thing for most of us. The mountains were still there when my train pulled out of Salt Lake City, white and enormous and indifferent and beautiful. I watched them until they disappeared, and I thought, yes, that's exactly where I was supposed to be.